Welcome to All Things in the Name of Love. If you like this show, please like, subscribe, and share. Thanks. Welcome to another episode of All Things in the Name of Love. And today I have with me Dr. Alex Jounnou, who is, among other things, the founder of Transformational Acupuncture. You help with nutrition, environmental situations, and counseling. You help cognitive behavior therapy, and you're a chiropractor. And I just love that you're doing this multidisciplinary approach, which I know is part of traditional Chinese medicine. And I want to thank you so much, first and foremost, for joining me on the podcast.
Yeah, thanks, Sophia.
And I want to ask you about your journey. How did you come into this, and what was your journey about exploring?
Yeah. Well, first of all, I'm not a chiropractor. I'm actually a medical doctor.
Oh, okay. I'm so sorry about that.
Yeah. No, that's all right. I've been a general practitioner, as they're called in Australia, for the last 40 years.
Oh, wow.
And I learned acupuncture about 25 years ago.
Okay.
That was after a long journey of healing for myself. In that back in 92, I developed Crohn's disease.
Oh, wow.
Which is, for those listeners who don't know, it's a inflammatory bowel disease of the small intestine. And the inflammation got so bad, and I, being a typical doctor, I completely ignored my own symptoms, which was quite severe pain at times. And till I collapsed at work one day, and I developed 2 4-inch abscesses in my abdomen.
Oh, wow.
Fistulating off the small intestine. So next thing I knew, I was whipped into hospital, antibiotics for a week, and then had 2 feet of my intestine cut out. And I lost 20 kilos in the process.
Wow.
And the thing was, when I was about to be discharged, I asked the surgeon if I should follow any particular diet or avoid any particular foods. And he said, no, you don't have to worry about that. You're cured. Eat anything you like. Literally his words. You can eat anything you like.
Okay.
And this is a surgeon who is actually famous in Australia for performing this kind of surgery on Crohn's disease. And so I did. But within 6 weeks, I started getting symptoms again.
Oh, yeah.
And I was threatened with further surgery. And I thought, there's no way I want to keep having bits of my intestine cut out.
Right.
I'd seen that in a number of patients in the past, and
Wow.
it's not a good road to travel along.
No.
Fortunately, I had a friend who is also a medical doctor, and he put me on mega doses of vitamins, and I went on to a gluten-free, nut-free, dairy-free, meat-free, everything free, which was quite restrictive. But the thing was, I dramatically improved. So that began my interest, because I'm thinking, like, I went to medical school and, got a passed with honors, and I thought I understood how the body worked. And I thought they didn't teach me anything in medical school about this. So that sort of began a journey, which ended up looking at the Chinese medicine, which looks at the body from a functional perspective rather than a pathology perspective. So that was a real eye-opener. But the ultimate part of my journey was sort of realizing, well, I came to the realization one day, it was a sort of an inward knowing thing, that I was losing loops of bowel because I was gutless in my life.
Wow.
It played out literally through losing my guts.
That's fascinating.
It is. And the same thing that told me about a year later, that when I was talking to somebody about Crohn's disease, it said you're lying, and I'm thinking, like, what do I mean I'm lying? This is, like, I've got Crohn's disease, and then it's like, aha, I don't have Crohn's disease. It was about probably 6 years after that initial, 4 years after that initial bout. So, and it's never occurred since, even though I eat a normal diet now and aren't on any medications.
That's fascinating. I love so I'm just curious because it's coming in. So when you first started tapping into the traditional Chinese medicine,
Yeah.
did you feel that inner voice start speaking louder?
Yeah, yeah, for sure.
Okay.
It was like going on to mega doses of vitamins and supplements and so on. After a while, became sort of disillusioned because I went into became a fellow of the College of Nutritional and Environmental Medicine
Okay.
as a part of that journey,
Mm.
and but then I became disillusioned because I realized a lot of these supplement companies are just pushing their supplements just like drugs from a
Right, right,
drug company.
right, right,
So it's nothing to do with healing the person. It's all about selling the supplements.
right.
And whereas the Chinese, it was much more about balance within the body and
Mhm.
healing within the body itself. And so I wasn't that attracted to Chinese herbs, but I was very attracted to acupuncture. So initially, I was offering it as a last resort to my patients, for patients with like severe knee pain who are
Mhm.
waiting for an operation for a knee replacement and things like
Mhm.
that, where painkillers weren't working for them.
Mhm.
And they kept getting results and kept telling their friends about me, and so I kept getting more and more patients for acupuncture. So
Wow.
it just became a natural progression, I guess. But
Mhm.
it really hit me in 2010, which was like 12 years after I learned acupuncture. I
Mhm.
went to a workshop which was called esoteric acupuncture, and that was using
Mm.
acupuncture to raise people's consciousness. And my first experience of it, literally, I felt like I was flying. And I'm thinking, I know I'm awake. I'm not asleep. I'm
Mhm.
awake. But it felt like I'd feel these two 6 foot wings flapping away
Wow.
in a slow rhythmic beat. And then I realized I'm looking over a landscape about sort of 200 feet up. And then I kept looking further and I saw a whole bunch of people. And then I recognized my then late wife and a friend, and and they, without going to all the detail, it meant that I received a huge hurt and pain,
Mm.
and and I and as a Christian, I'd sort of studied the Bible from front to back to learn how to forgive.
Mm.
And though at an intellectual level I forgave them, it was at a level much deeper. I
Mhm.
knew there's stuff there. And as I was seeing these people, when I'm looking down, this is all while I'm on the acupuncture table. It's it came to the realization that these people weren't trying to hurt me. That any hurt to me was a byproduct of the dramas going on in their lives.
Mhm.
And as soon as it's like I heard a voice say that, or
Mm.
myself say that to me. It was like immediately felt like my heart opened up,
Oh,
and a
wow.
flood of super strong feeling of love and compassion for these
Mm.
people, and forgiveness. And that was such a powerful experience that it never left me. That it
Yeah.
changed my life,
Yeah.
uh, more than any taking pills and so
Mhm,
on.
mhm.
So my first thought is I've got to get me more of this. and
Yeah.
and when I met my current wife, I had a treatment, and I was thinking about my late wife, and there was sort of pain there in my heart, and I was having a treatment working on my heart,
Mhm.
and it was a feeling of, for all the world, it felt like angina.
Mm.
Being a doctor, I've seen many patients over the years, and they've described the pain and so on. It felt exactly like that, but though it was much shorter, and I don't have a history of heart disease, and I've
Mhm.
had tests since which shows my heart's perfectly normal.
Uh-huh.
But the feeling, the description was, a broken heart, really.
Mhm. Mhm.
And and as I experienced that, it was again this feeling of love and compassion for myself, which was huge, because I'd realized I was just an average everyday human being trying to make my way through this world, and I'm not perfect, and so I had this feeling of love and compassion for myself, and it's like that, all the stuff from the past seemed to basically resolve, melt away, I
Oh,
suppose
wow.
would be a good description.
That's
So
beautiful.
yeah, thanks. And that obviously, me being who I am, I just love to understand and want to find
Mm-hmm.
out. So I learned the technique, and then I um, developed it into a whole system, because the guy who was teaching this was saying, don't use it on people with mental health problems. It can make them worse.
Hmm.
And and when I saw him a year later, I said, well, that's mainly my number one patient is people with mental health problems,
Mm-hmm.
because it's such a common thing, as you know, in society.
Right.
And they inevitably go to doctors. And I'm saying, well, let's try acupuncture.
Mm-hmm.
And I was getting amazing experiences with these people.
Mm-hmm.
And particularly the first one, where my wife, who's also a medical doctor, says, you've got to document this, because I told her that this woman came to me with osteoarthritis,
Mm-hmm.
widespread in the hands and hips and the knees,
Mm-hmm.
and her GP, who is also in my practice, had put her on opioids to relieve the pain.
Wow.
The pain was really bothering her, and I said, well, and she didn't want that because it was making her dopey.
Mm-hmm.
And I said, well, let's try the acupuncture. I mean, she and her family had seen me on and off for years in the practice. So we tried it, and within 3 weeks, after 3 treatments, she literally stopped the opioids.
Oh, wow.
And and after another probably month of treatment, she said that, can I stop my antidepressants? And I said, what's the story there? She said, well, I've been on them for 16 years and I don't think I need
Wow.
them anymore. So I thought, well, perhaps she didn't need them anyway. Often doctors keep prescribing these things, and
Right,
patients keep.
right.
Because the general advice is, if to doctors, is if a patient's had their second episode of depression, they should take medications for life. No ifs or buts. So I looked back through the records, and the doctor had tried getting her off the antidepressants the year before, because she asked to try going off them, and she thought she was okay. But within 6 weeks, all the symptoms returned. So
Hmm.
she went back on it. But this time she says it feels different.
Okay.
So over the next few weeks, I weaned her off them. And it really hit home to her and to me when, because around that time, it was just before Christmas, and she said that she heard a knock on the door, and opened the door, and there were some Christmas carolers there singing to her. And she said all these tears came flooding out, and her heart was bursting with joy and happiness. And she said she hadn't had that feeling for many, many years, not since
Wow.
before the antidepressants. And my wife says, like, that's it. Stop mucking around. You've got to study this. So I followed a half a dozen patients with depression over the next year.
Mm-hmm.
And they just purely presented with depression, and they all got better. And following them up a year after treatment, that they were still without depression. And so then since then, I've sort of studied it further and a bigger study. And then the last few years, I've been training other acupuncturists in this method, because I thought, there's only so many people I can treat in my life.
Right,
And
right.
now retired from general practice.
Mm-hmm.
And so for the last year, I've been training acupuncturists online. So I can reach acupuncturists around the world and train them
Oh,
in
I
this
love
method.
that. I love that. I'm so curious because I'm very, have been left brain, got a PhD.
Yeah.
And then from my understanding of traditional Chinese medicine, it's more right brained and intuitive, especially with the
Yes.
meridians. And
Yeah.
so how have you reconciled that in your brain? Because like the Western
Yeah.
medicine.
Well, that's a really good question. Initially, it was very, very hard, because
Yeah.
I found myself thinking, oh, okay, I'd have a patient in front of me, and I think, well, from the Chinese perspective, I'd say this, but that doesn't make sense because from the Western perspective, you think that.
Yeah.
And so it was like I was wearing two hats for a long time. If I
Mm-hmm.
was doing acupuncture, I had my Chinese hat, and if I was doctoring, I had my medical hat or Western
Yeah.
hat. Then I came to realize that it's just the same body we're dealing with. It's just viewing the body from a different perspective.
Mm-hmm.
And Western medicine is always focused on pathology. Find a diseased tissue sample and look at what's happening to the hormones and what's happening to the blood levels, if they're within a normal range or not,
Mm-hmm.
and imaging to look for pathology. So all of this then results in, you look at the body from one way, but the Chinese perspective, they look at the body from the point of view of function rather than form. It's
Yeah.
all about function, how things
Right.
are working, whether they're in balance or not.
Mm-hmm.
So that sort of was really the key to letting me in to understand these things. Because, if you go to a Western doctor and they do a blood test and say, well, the tests are all normal, there's nothing wrong with you. If
Mm-hmm.
you've got chronic fatigue syndrome, you'll know that there's something wrong with you, all right.
Right.
And from a Chinese perspective, you can analyze the situation and say, okay, well, this system's out of balance and
Mm-hmm.
there's too much energy here and not enough there. So that all makes perfect sense in the Chinese. But from the Western viewpoint, if there's nothing that they can physically find wrong, there's nothing wrong with you.
Mm-hmm.
I mean, I tell patients, I explain it in terms of, imagine you've got identical twins and one runs a marathon and the other one sits at home watching the footy on television,
Mm-hmm.
and they both present to a doctor the next day. The doctor won't be able to tell them which one was the one who did the marathon.
Mm-hmm.
And yet the person who did the marathon will certainly know that he ran a marathon.
Right.
It'd be, but there's no physical test that you could do to demonstrate which one's which.
That's fascinating because I remember I went, I'm going to say about 12 years ago, I was living in Portland, Oregon, and I just I was on, it's called 82nd Street, and it's where all the Chinese, where you can get all the food, and there's practitioners there. And we drove past this traditional Chinese medicine doctor from
Yeah.
China, called himself Dr. OJ. And I'm like, well, I'm just curious. And he looked at my tongue and then did a couple other things and made this god awful concoction of herbs that I'd never heard of, and I was supposed to boil it and drink it every day for 3 weeks. And
Yeah.
once I actually got it down, it was a thing.
Yeah.
I definitely felt the difference because he wasn't looking at like, okay, what organ is going on? It was, it was like, it was a different way of diagnosing. And I thought it was really fascinating because it had nothing to do with anything I'd ever experienced before in terms of looking at like, okay, so like for example, I'll say the middle of my left foot, like right where the arch is a point in acupuncture that is affecting some meridian.
Mm.
And the Western model for me doesn't really make sense anymore because I'll give an example. My mom was going to have her hip replaced about 10 years ago, and we went to see a doctor who was like checking her pre operation, and he's like, well, you need to have something inserted in your heart because of your pain. And I said, well, what about turmeric? And he said, what about it? And I said,
Mm.
I don't mean to be racist, but you're from India, you use turmeric, right? And he's like, yeah. And he's like, well, have you ever looked at the applications of turmeric? He's like, why would I do that? And I'm like, okay, there's something
Mm.
inherently wrong with the
Yeah.
Western
Yeah.
model of like, there's no understanding of the integrated system of the
Yeah.
body in
Yeah.
relation
Yeah.
to food and herbs and the points on the body that affect our health in many ways. And so
Mm.
unwinding from that program of the model of Western medicine must have been an ordeal.
Yes, that's true. Yeah, especially yeah, copped it from colleagues.
Oh yeah. What did they think about you going on this
Well, they thought
route?
it was a bit of quackery, but the thing is, they kept getting patients coming to me, and they were getting better and going back and telling them that I fixed their problem. So it's hard to deny the reality of that over time.
I love that.
So yeah, and yeah, it's just I guess the form of acupuncture I do, which I've called transformational acupuncture because I've seen people's lives transformed by it,
Mhm.
is an interesting blend of the Ayurvedic understanding of chakras and the
Mm.
TCM concepts of meridians, and using acupuncture to actually directly affect the chakras.
Ooh.
So it can, so it really works at a level of mind, body, and spirit.
Mhm.
And the chakras are associated with the various endocrine organs and various yeah, nerve complexes.
Mhm.
So you can really have some very powerful effects. And most people who present to me with depression or anxiety will have physical problems as well.
Mhm.
And often they'll resolve as well as the mental problems, even though there's, from a Western medical perspective, there's no direct connection between the two.
Mhm.
And likewise, people who are presenting with physical problems, and I was using this form of acupuncture to help them,
Mhm.
they were getting the mental changes as well.
Mm.
I guess I sort of first realized this when I thought, I wonder if I use this style of acupuncture on people with low back pain. So I had some patients with low back pain, and when I assessed them from the chakra perspective, I realized their root chakras or the second chakras were blocked.
Mhm.
And so I worked on the pattern to unblock those chakras, and lo and
Mm.
behold, their low back pain was going away. And a lot of them were finding that in the past they regularly had a flare up and would come to me regularly for acupuncture. But with this, it was much more powerful and longer lasting. So they were very pleased with that. And so using the concept of chakras to actually alter their physical symptoms. So the low back pain wasn't because necessarily of a slipped disc or because of arthritis in the spine. It's
Mhm.
at a much deeper level of the mind connection that's going on.
That is
So
fascinating.
yeah, yeah, yes, and it was because people kept saying to me all the time that not only was I fixing their problem, but they were finding they were getting on better with their wives or husbands, or they were getting on better with their work colleagues. They weren't taking their work problems home with them. They were having more family time with the kids and things like that. And that was when my wife kept saying, "You got to check this out. You got to see what's going on here." And that wasn't until I had that woman with the depression for
Mhm.
16 years. I thought, wow, that's powerful. And I wanted to check it out to find out if that was just a fluke or whether it was real or not. And
Oh yeah.
yeah,
How has
and
your wife received this, like all of your studies?
oh yeah, she's brilliant.
Has
Yeah,
she
she's
come on
brilliant.
board with it too? Like, is she understanding it from a deeper
Oh
perspective?
yeah. She's was a Western trained doctor. She was a nurse first, and
Okay.
became a doctor. She graduated when she was 51. Believe
Oh
it or not,
wow.
in
Awesome.
medicine. Yeah, so she thought all her friends were retiring, and what am I going to do with my life if I just retire? And then she
Right.
thought, well, I could spend the same amount of time studying medicine. So she did. And at any rate, she went on to do integrative medicine,
Very
and
cool.
because she had approached it from the other direction, which she was already a herbalist
Okay.
before she went into medicine.
Oh,
But
interesting.
yeah, and then since she's learned hypnotherapy as well, so we integrate quite well in terms of working on patients and that.
That's beautiful.
Yeah. So it really is because she realised it's about the mind connection is so powerful that
Hmm.
most patients when they go to a doctor they just think of it in terms of something's broken in my body and either needs to be replaced by an operation or cut out, or give me a pill that will suppress the symptoms.
Right.
And that's basically, Western thinking. Just, I think, developed really around the time of Descartes or even before him, where it's like the priests deal with the spirit and the doctors deal with the body.
Right.
And then later the psychiatrists deal with the mind, but they don't talk to each other.
I know, it's so fascinating because it's like it's all so interconnected, and
Totally.
I recently had an awareness that my front teeth are connected to my kidney meridian, which is connected to my feet, and like just learning the meridians and how they show up in different places in our body, that just trips me out.
Yeah. It's often interesting because, like I could be needling somebody and they say, well, I came here because I've got a hip problem and you're sticking needles in my forehead, and they just can't get it. And then they're lying there, and when I come back in, they say, I could feel all this stuff shifting in my hip. And they're just blown away by that.
Oh yeah, it's just so fascinating because our body is so interconnected, and that's what always fascinated me with, like, oh, I'm going to be a heart specialist. Well, the heart is like way bigger than anything on a chart. Like all of the energy that that's carried within the heart chakra is like, don't even know.
And even from a Western perspective, it was 1982 when first study came out that demonstrated the heart is actually an endocrine organ. It produces hormones, including serotonin and oxytocin. It's actually produced within the heart. And that the heart has the cardiac plexus of nerves around it, which sends more information to the brain than the brain sends to the heart. So when you feel things in your heart, heartache or broken hearts, and that, it's very real. It's really is the heart telling you things. And the electromagnetic field of the heart is like I think it's 5,000 times stronger than the electromagnetic field of the brain. So I'm sure a person's heart can actually sense the energy of another person's heart, and you can feel uncomfortable when you're conversing with someone and you're not sure why, but somebody sort of creeps you out, and yet somebody else, you get that instant connection. And I'm sure that the heart's saying, okay, I check this person's heart out and they're fine, they're a good-hearted person, and tells your brain all at a subconscious level.
Oh, I totally feel that, because I mean it's a combination. Like when I have a Zoom call, I can feel your heart resonance. It doesn't matter where you are in time and space. It doesn't matter. I can also feel it with a picture, which is really fascinating to me, because that's how I work with animals most of the time, is with a picture. And I can feel what's going on in their systems and just know where they're at. And it's just fascinating that our energy is like, it's subtle, but it's that much more than we think it is.
Definitely.
Yeah. It's just so much fun to like feel into that. So when you have your practice, is it all in person or do you do remote sessions? I don't know how that works. So
well, I've retired from actually practicing.
Okay.
As of about 3 weeks ago, I sold my.
Oh, congratulations.
I sold my practice, and I've finally, yes, I'd grown it from a solo practice up to 12 doctor practice with nurses and chiropractor and dietitian and nurses and
that's beautiful.
exercise physiologist and so on. So yeah, but I thought, well, I've got only so many more years of my life. I wanted to devote 100% of the time to helping other acupuncturists in this method, so that they can reach out. I mean, having said that, I bit reluctant to talk about it, but I can use a pendulum, and I have used the pendulum on two of my grandchildren when they were babies. They had difficulties, and even though they were interstate, I was able to work on their chakras and
Mm.
even them out. And both the mothers felt, I could see the evidence with their babies that there was a shift in their
Mm.
energy. But as I was doing the treatment from, like 500 kilometers away.
That's amazing.
Yeah, so but yeah, I don't do that as an everyday thing.
No, I
I
can.
know. I mean, I've spilled the beans now, but I've never talked about it before.
That's okay. I appreciate that because I know what it's like. I remember the first time I had a body talk, I took something called body talk access for animals. And it's just a tapping
Yeah,
technique. And the trainer was in Ireland and she said, okay, I want you to work on this dog. Well, the dog's owner, the human rather, couldn't call into Zoom. So he called on his phone. So I see a picture of the dog on a phone on Zoom.
yeah,
So I'm not really seeing the dog clearly. And
yeah,
I start tapping, and I am in Oregon and the dog's in Ireland. She was hyper. By the time I finished the tapping, she was sound asleep.
yeah.
And I was like,
Amazing.
oh, okay. So really, we are quantum beings.
Yes, yes. Yeah,
And
there's so much about consciousness that we don't understand.
yeah. How have you seen that come in? Like when you were practicing, how did you see that come into your sessions?
Well, it's funny because I'd known for a long, long time, but I didn't sort of recognize it at a conscious level that it was like as the patient was coming in through the door, I'm already thinking of a certain organ or
Oh,
something like that.
wow.
And I'm thinking, why am I thinking that? And then they would say something
Mm,
and spot on. And yeah, interesting stuff like that. And I guess, I grew up my dad was, who I idolized, was a teacher of physics and mathematics and
mm.
computer language. And, so he had no concept of intuition. And thinking back over the years, I was quite intuitive, but
Mhm.
I always tended to do the opposite of what my intuition says
Oh.
just because it didn't seem to be logical. That concept of logic
Mhm.
it was so powerful following my dad's footsteps that I denied it for years. But since then, I listened to my intuition, and it saves me a lot of problems.
I completely understand that. The few times I haven't listened to my intuition when I wasn't as tuned as I am right now, when I don't listen, that's when I get in trouble.
Yeah, yeah, yes, exactly.
And sometimes, like today, I don't drink coffee anymore, but for some reason, my body's like, "Can I have a little coffee today?" I'm like, "Really? You want coffee? Because you know how dry you're gonna get." I'm like, "Yeah, I just need
Mm,
a little coffee." I'm like, "Okay." So I did, and I'm fine. But it was like, okay. So I usually tune in if I get something that's intuitive. Like
yeah,
I also love grounding. So today it's sunny
mm,
out, and it hasn't been in a couple months in Oregon. So I laid out in the grass today, and that was intuitive.
mm,
And it just felt so good to soak up the sun and lay in the grass and just feel the energy of the earth. I tend to live my life with intuition because usually it's
mm.
really, really like exactly what I need. Actually, I haven't ever had it not be exactly what I need. And then when I ignore it, I kind of mess myself up.
Yeah, fair enough.
Yeah.
Yeah, yeah, it's all a fascinating subject, but yeah, we're not only doctors. I mean, most of society ignores these things.
Right.
I think we'd all get along a lot happier if we did listen to our intuition.
Yeah.
And often with acupuncture, when I'm treating someone, they'll often start talking about intuition and that, and I quiz them, and they often say that they were felt they were intuitive as children, but
Mm-hmm.
then they lost that sense. But
Mm-hmm.
then with the acupuncture, that feeling comes back.
Oh, that's really cool.
Yes.
I love
So,
that. Yeah, it's fascinating that like as the chakras begin to spin properly again and
mm,
open up, how that affects our whole system in terms
Mm,
of our intuitive abilities.
yeah, absolutely.
Yeah, I feel like when I was little, up until my 20s, I get songs in my head. I used to play. Do you remember the show Name That Tune?
Yeah, yeah, yeah.
Okay, so I'm under 5 and I beat my parents in that
Right.
because I'd hear the note and I'm like, that's the song. And they're like, how do you know that? I'm like, I don't know, but I did. So through my 20s and 30s, I'd always hear lyrics to songs. And now
Yeah.
I have this intuitive knowing than the lyrics, or an awareness like I should be doing this now, um, that I didn't have when I was younger. So it's interesting to see how that's
Mm.
evolved over time and how it's changed. Although I still get ABBA songs in my head regularly, I don't know why.
Very catchy, those tunes.
Yes, they are very codependent and very catchy.
Yeah.
So, how have you seen, like, since you started this practice with
Mm.
the chakras, how have you seen your intuition develop more?
I definitely, I had long history of sinus problems, and it relates to the third eye
Hmm.
chakra. So when I have regular treatments of acupuncture on myself, which I get my wife to do that, I'm definitely got greater clarity of mind
Mm,
and more intuitive and so on.
very cool.
Less, let alone being less stressed and scattered, that sort of thing.
Hmm. Hmm.
Yeah, a lot more focused and a lot more intuitive. Yeah,
I love that.
as well as the sinus symptoms improve as well. So,
Yeah,
yeah.
I definitely feel that. Like I think it's the left side of the second toe. I think that's the side that, or both toes, but the left side of the toe. Um, that's the third eye. I think that's where it is. Because I have a friend who does acupuncture or acupressure.
Yeah, right.
And the few times she's worked on my feet, I've been like, "Ugh," when she hits that spot. She's like, I'm just clearing out your pineal gland. I'm like,
Yeah,
okay, thank you.
yeah, it's good stuff.
Yeah, it is.
Yeah, yeah. It's it just as I say, it just shows you the Western model of the body is very simplistic, really.
Hmm. Yeah.
Certainly in terms of the mind, it doesn't begin to explain what consciousness is.
Right. Right. Did your dad ever explore quantum physics or just physics?
Yeah, he explored quantum physics. Actually, told me when he was a young lad, he actually went to a lecture by Niels Bohr,
Oh,
who's
cool.
first proposed the model of the atom and that. So that's really cool.
So did he so like because he didn't get consciousness, but did he understand the model like before science and spirituality
Hmm.
started like coming together? Did he see any of that? Did he understand any of that? Did you ever talk about it?
Um, well, he was always more into the physical aspect of it
Okay.
rather
Okay.
than the spiritual aspect. I don't think he ever made that connection.
Okay.
He's still alive. He's 96 and in a
Oh,
nursing home.
wow.
He's unfortunately, the Alzheimer's takes a
Oh,
toll. But
yeah.
the other day, and one of the nurses said she gave him a algebraic equation to solve, and he solved it. Just looked at it and solved it.
That's really cool. Yeah, my mom has dementia and she forgets a lot. Put her in front of a piano and wow, she can play, like, brings me to tears. She's just like that part of her brain is still functioning.
Yeah,
And it's
yeah,
just really fascinating to see what part of the brain decides to fully function versus the parts that are deteriorating.
yeah, yes, yeah. It's a very difficult subject.
Yeah.
And management, really is super basic. Really,
Yeah.
we haven't really got any real treatments for it.
No, not yet. But
Uh,
Fortunately, yeah, I'm grateful where my mom is. She's in a very, very amazing facility with a woman who manages it, who loves working with people with the dementia and
Mm,
Alzheimer's. So the whole staff does too, and it's like,
yeah,
thank
yeah,
you, because that's
yeah,
that's a
yeah. It's not easy, and you know, we went to a case conference recently, my brother and I, and we just sort of thanked the staff for their care because I thought this is something I couldn't possibly do,
yeah,
and yet they do it every day,
right.
day in day.
Oh, it would be cool. And this is like a sideline that just popped in. That would your dad be open to acupuncture?
Probably not,
Oh, okay, okay, yeah, I get that.
but yeah, yeah. I mean, certainly the thought crossed my mind.
I'm sure it has. Yeah,
Mm.
I've offered my mom body talk session, and she's like, "What is that stuff?" Anyway, never mind.
Yeah,
So
yeah,
yeah, it's interesting to see where everybody is with their interest in the healing process
yes, yeah,
and
it
how.
is, and yeah, for me, I guess that's where I get the greatest satisfaction is in helping people to grow spiritually,
Hmm.
um, because we're all going to die one day. So you know,
Right.
medicine can only prevent death sometimes from happening now, but
Hmm.
delays it's only a delay.
Right.
Ultimately, we all die. But
Hmm.
if I can help a person to grow,
Mm.
that I think is the best gift I can give them.
Hmm. Definitely. I feel that as well.
Yeah.
Hmm.
Maybe reminded me, I haven't thought of it for quite a while, but I had a sister-in-law pass away um, 20 years ago, I guess. Yeah. And I gave her the acupuncture the night before she died, and and I said, "How at the end of the treatment, how do you feel?" And she said, "I feel peaceful.
Mm.
Yeah, my job is done."
That's beautiful.
Yeah.
Yeah, having that inner peace is such a magical experience,
Hmm.
and to help us.
Especially yeah, I mean, and doctors, like to help people. I mean, I don't think
Yeah.
I've met a who doesn't. But it's like when you feel like you can't do anything as a doctor,
Hmm.
like the person's line, for example, the tendency is for doctors to just give up,
Mm.
just to avoid the drama of the situation
Right, right.
of it. But there's still a lot one can do.
Hmm. Oh, I think so
So
too. Yeah. There's so many
mm,
different practices that help the body, because I think our
mm,
bodies innately want to be healthy,
yes,
and we just have to remove the layers of programs and beliefs that we have that keep us from being in that state of health.
yeah, yeah. It's a sort of a letting go process,
Hmm.
isn't it?
Definitely. It's a journey to unfold, right?
Absolutely, yes.
Well, I am going to ask you one more question, but first I
Mm.
want to thank you so much for showing up and sharing your story with me. And I want to ask you how people can find you.
Yeah, through my website, stickittodepression.com.
I love that website.
Yeah, just stickittodepression.com. And
Beautiful.
I've got information there for other acupuncturists, but also for doctors and patients. And if you
Beautiful.
want to, you can sign up to my newsletter and get regular updates, plus links to my books on Amazon as well.
Well, before I go, what are your books?
Oh, Stick It to Depression. The first one is subtitled Another Tool in Your Doctor's Bag. And I wrote that specifically to tell doctors, make them aware that acupuncture is an option,
Mm-hmm, mm-hmm.
and look at discuss some of the failings of Western medicine.
Mm,
The second book was Stick It to Depression, Get Your Life Back Naturally.
mm.
And for that, I've written it more to the general public to make them aware of acupuncture.
Mm,
as a modality.
awesome.
Yeah.
Thank you so much for your time, for your work in the world, for all that you're doing to help humanity. I'm so grateful.
Thank you.
You're welcome.
It's a pleasure being here today.
Thank you.